first part of the open conversation was all about building on that great feedback we get from the work we do in the Trust to get the same kind of engagement right across our system. The second part of that conversation is about what do we do with that feedback we've received? What action is it that we can take that will create better conditions for our colleagues who day in, day out work really hard for our patients and our service users? For us, the open conversation work is really important, partly because it's a genuine system-wide attempt to build the right kind of leadership and management and support for our staff. And the more we get that right, the easier those partnerships become. And secondly, because for us, the capability, the capacity and the quality of our local leaders and line managers is at the heart of everything we do. And so the more we can do to help them, the more we can do to help them working with other trusts in the system, the better from my point of view. So a lot of what we need to do sits firmly within each organisation, but I think the lesson from the open conversation is we can do it better together. Right across all the trusts in our system, our colleagues are telling us very similar things. So the kind of messages we get here in BCHC are very similar to those in other trusts, and that suggests we're better tackling this together. I then pick out two further things. The first was the extent to which, for our colleagues, getting our leadership style right makes a huge difference. Genuinely bringing to life that commitment to compassionate and inclusive leadership, and doing so in a way that means colleagues can safely raise issues, confident that those issues will be properly heard, and confident that their leaders and managers will respond. There are two reasons why people should help us this time. One, as a system-wide effort, this is the largest scale attempt to do this kind of thing we've ever tried right across Birmingham and Solihull, and has the commitment of all the NHS trusts in the system in a way we've never had before. And secondly, because the sharing the offer is an attempt to test whether we've heard the right things and acting on the right things. And as I say, if we have, that's great, we will crack on. If not, and we need to rethink, we will. So I guess the big vision for all of this is that we can create, right across the NHS and social care in Birmingham and Solihull, a culture that is properly focused on our patients and our service users, that is compassionate and inclusive for our colleagues, and as a consequence of that is doing a great job for people at the time when they need us most.